because I have two screens. Just to share with you, I'm going to present on behalf of my colleagues, Dr. Huda Hakim, Professor Mokbul. By the way, Huda Hakim is my wife. Just to raise this point. And I'm going to talk about the impact of war on the health services and NGOs in Sudan during the period of war. And I think over the previous conferences and my fellow speakers, we all agree on the severe and significant impact of war on our country and on our people. That was not limited only to the health sector, but almost all aspects of life in our beloved country. So I will briefly go through the status of the health system in Sudan before the conflict, the impact of the current war, and then the impact on specifically on this humanitarian response and the role of the NGOs, and try to share with you some ideas on how to recover in the post-conflict era. So, as we all agree, this war has severely impacted the lives and well-being of people of Sudan. Particularly, the health sector has suffered damage of its infrastructure, disruption of the functions, and of course, the increasing demand. Because even before the war, the health system was not able to meet all the demand, and you can imagine the situation after the sharp increase in the demand. So this paper, inshallah, as will be published, try to examine the impact and also suggest strategy for rebuilding. So in snapshot, since the independence,
sorry, the slides are not moving, Dr. Haitham. So are you moving them? It's not moving.
Yes.
But it's still on.
Yes. Yes, I'm moving them.
No, can you stop? Yes. Okay, now it's moving.
Moving, okay.
Yeah.
Okay, so since the independence, the health system in Sudan suffered many challenges. Among those challenges are contradictory visions and strategies. Each regime comes on with its own ideology and governance and health system. So it shifts with the governor in simple way. And then the period 1989 to 2019, although there was very nice, well-written strategies, policies, clear vision, but unfortunately, those strategies, visions were not aligned with actual and proper implementation on the ground. And I think we all witnessed that period, and we can share many examples of such gap or lack between the vision and actual implementation. Then the period 2018 till the April 2023, there were frequent changes in the higher and technical leadership positions, and many even conflicting visions and policies at that time. During all those eras, there was a long history of persistent instability, as Professor Mardi mentioned, resulting in a protracted complex emergencies. شفنا the war in the south, the war in Darfur, and many other parts of Sudan. So we have been, unfortunately, in a continuous status of complex emergencies. with displacements, with malnutrition, epidemics in the viscous surface of such emergencies. The health services, the same, they lack essential resources. We have challenges with health professionals, etc. And this resulted in, unfortunately, Sudan has been for a long time among the bottom list of countries with poor health indicators. Although we have, I believe, the most sharp minds and expertise in health, public health, all around the world, benefit all countries all around the world, but we couldn't do it for ourselves. And obviously, if we continue like this, we are going to fail meeting the benchmarks for SDGs and the universal health coverages in 2023, unless we do something. So moving to the time of the conflict, and I do believe that I need not to say much. All of you are following what has been there, but this situation, as Sudan has experienced the highest level of humanitarian need worldwide, and we witnessed the collapse of the functioning of the health system with weak health information systems. This is another challenge because we keep seeing numbers and reports, indicators, but we cannot guarantee their accuracy simply because the information system is questioned. It's not reliable. So this is another gap that limits our planning and appropriate response to the needs. And this, I think, can be applied for all sectors, the lack of accurate data and information amid conflict. So this is, I apologize, this is a very complicated or quite complicated scheme, but it shows us the complex emergency in Sudan over the last 2 years, from violence, the natural emergencies, flooding, displacement, loss of livelihoods, violation of human rights, sexual violence, injuries, mental health problems, destruction of the environment, failure of crops, malnutrition, increased vulnerability of diseases, collapse of economic infrastructure, water, safe water, hygiene and sanitation. All those lead to decreased immunization coverage, as we'll see, and failure to meet the need for the treatment for chronic diseases. And all those factors together, they increase the vulnerability to diseases, epidemics, and sadly, mortality. So I'm not going to go into the details of those numbers, and just to declare that those data were obtained before the recent advancement on the ground, maybe in the last 2 months. So many conflicting actually reports and sources, but most of them, they talk about thousands of those who were unfortunately killed there through or as a result of direct conflict. Thousands were injured. Over 15 million Sudanese are in need for health care. Almost 12 million actually displaced, either inside or outside Sudan. More of, or 50% of them are women and girls. Again, the chronic diseases, almost 60% of patients struggle to maintain regular hemodialysis. 65% they find difficulty in getting their regular treatments. no one actually talks about mental health and this type of social stress that our communities are suffering now. And particularly for women and girls, more than 1 million actually pregnant and breastfeeding women lack access to basic maternal health services, with almost 250,000 pregnant women are in urgent need of help. Regarding the health services or health facilities, again, I really don't like showing numbers, because the idea is that we are very unfortunate by losing even one soul. But those numbers just to provide a close look or snapshot on what is the situation there on the ground. So more than 70% of the hospitals being impacted, youth and 100 ambulances, vehicles, direct attacks on health facilities. Unfortunately, also on health workers, we lost colleagues who were serving their patients inside the health facilities and away. Just one point to mention here is that following the attack and looting of the National Public Health Lab, this actually raised a serious health security alarm, because many samples with pathogens were lost. We don't know where they are or what is their end. So again, this raised a serious issue to trace and look for those samples and the impact continue. And just to mention that our immunization coverage dropped from 85% to 50%, and this was by mid-2024. And Gavi supplied vaccines dropped from 67% to just 16% now. We are following many epidemics, including cholera, malaria, dengue fever, and many others actually. So this screenshot I received yesterday, and just to show you the increase of the cholera cases, taking Khartoum State as an example, but we have to admit the resilience and the hard work being done by our colleagues in the Ministry of Health through this difficult time with limited resources to bring this curve down. And here I really would like to acknowledge their commitment and hard work. So in brief, we have unmet needs, and I can summarize them into 2 points: access and resources. We don't have access because of the security, sometimes because of the politicization of some operations. And resources, we have this existing wide gap between the needs and the available resources. And over 80 agencies, at least I know, over 80 agencies are operating in Sudan, but this also creates another problem of chaos and lack of coordination, and of course accountability with the conflict in Sudan. We have real and serious issues with data. We don't know exactly our denominators simply because of the movement, displacement. Some left their states and then went back after the situation there. And here where we need the input from Professor Mardi and other colleagues, how to better manage our data. We need there are changes access, as I mentioned earlier, the quality of services, transparency, efficiency, capacity, and utilization of available technology in order to get the right information in the right time to make the right decision and actions and looking forward for the required outcomes. So, as I mentioned, many players are now in the field.
Five minutes.
Okay. We witnessed our national NGOs who played a crucial role in responding to the current emergencies, but the gap is huge. We are talking about billions of dollars, and the actual received is far below this number. And I will not talk more about Sudanese diaspora. I think Professor Yusuf and Professor Ahmad already mentioned this, but definitely diaspora a role to play in this situation. And we conducted a quick survey for 78 international agencies, asking them about their perception, what's going on in Sudan, and simply they referred their limited contribution to the limited resources, because they are also supporting other priorities or priority emergencies around the world, Gaza, Ukraine, and others. They questioned the accountability system in Sudan during this time of war. Many mentioned the complicated money transfer system to Sudan and the approval procedures. I will jump to the suggested model is that we are in need for to plan for strategic recovery, and I present what we call as authors the comprehensive health action plan to ensure sustainable, resilient, decentralized, community-based, and equitable healthcare systems that really address the actual needs of the people of Sudan. And those are the characteristics of the plan that you can find in the chapter. It ensured the mentioned characteristics throughout, the contingency planning, addressing the short as well as the long-term needs. And we do believe that the current situation is really a good opportunity to rethink our health system and to build it back better and align it to the international as well as other national policies and strategies from other related sectors in Sudan, including education, energy, water, and others. So those are some reasons behind what we believe the weaknesses in the health governance in Sudan, fragmentation, lack of clear roles, and what to be done. Similarly, for the health workforce, how we can better build or the capacity of our health workers. And this goes well with what Professor Yusuf and Professor Al-Mardi have presented. And also set of recommendations to improve the accountability and transparency of the health finance and reform. And finally, we recommend for Sudan is to adopt a community-centered, decentralized health system. And I think we have, as Sudanese, we have the experience in proposing or developing such a holistic community-centered approach that can work for our country. And I think the time for action is now. This is the best time to sit together and share efforts and see what we can do to support our health system there in Sudan and our people in Sudan. Thank you, Professor Mayada.